Hello, everyone. Thank you for tuning in. My name is Lauren Appel, and I am a senior at Randolph College. Today, I will be presenting information from my research entitled Asylum Seekers in France and England, a Healthcare Policy Crisis. To begin, I will give a short backstory as to my motivations for this project. Over the course of 4 years at Randolph, I have developed a passion for aid work, especially with Spanish-speaking asylum seekers in the U.S. from Central and South America. During my work, I began to grasp the many difficulties that these groups of people face. With a better understanding of the complex nature of the refugee crisis occurring on our own home soil in the U.S., I was interested in learning more about the refugee situation elsewhere in the world. This brings me to this past winter when I was given the opportunity to use the RISE grant to travel to Europe to conduct research on the current refugee situation affecting the Western European countries of France, England, and Spain. Here, I was able to interview people who worked with NGOs, the local governments, as well as everyday citizens of these countries to learn more about their personal opinions and aid opportunities for asylum seekers in their area. An important note before I start discussing my research is that even though I spent time in Spain as well, for the purpose of this research, I decided to focus on the nations of England and France in particular, since they seem to have the most tense relationship with asylum seekers in accordance to the information I gathered. Moving on to my research, it is important to note the true definition of who an asylum seeker is. The definition for a person who holds this title is someone who, from fear of persecution for reasons of race, religion, social group, or political opinion, has crossed an international frontier into a country which he or she hopes to be granted refugee status. In the case of England and France, most of these people are escaping their homes in the Middle East or Africa for several reasons listed above. The process of being assigned asylum status is similar in both England and France. Once the proper paperwork is filed, it will be processed by the courts until a judgment can be made as to whether to grant status for a longer length of time or to require them to return to their home country. This process can take weeks, sometimes months, before a decision can be finalized. In the meantime, the host country is supposed to provide adequate care for the asylum seekers. This includes food, shelter, basic education for children, and health care, which is provided either directly or by caregivers through directed funds. This leads me to the point of my research. Some of these categories are lacking tremendously, leading to negative consequences and quality of life for the people stuck in these situations. One major problem I have found that is affecting asylum seekers perhaps the most in both England and France is access to proper medical care. Before I discuss more about asylum seekers in England, I would like to note that my research was conducted prior to the nation's departure from the European Union. England's relationship with asylum seekers has faced strain in recent years. Facing multiple terrorist attacks from people of Middle Eastern nations and economic concerns, the country has seen a shift towards more negative attitudes towards allowing potential asylum seekers into the country. These attitudes have begun a shift in government and policy making towards granting asylum to make the process more and more difficult. Although this is the case, there has been a steady number of asylum seekers that are still permitted into the country with their applications. As a nation with universal health care, otherwise known as the National Healthcare Services, all people are entitled to health care coverage which is paid for by government-collected taxes. That being said, asylum seekers are also included in this healthcare system, although they do not pay anything in taxes until they are granted a final decision. Even though government policy states that these people are given the right to access medical care in their country, it is rarely the case. Often, asylum seekers are forced to wait for exceptional periods of time to see medical professionals despite their area of concern. Sometimes the only exception is in cases of extreme emergency. Although English citizens themselves complain of long wait times, for asylum seekers the situation is often much worse. Some providers are outright refusing to see asylum seekers, citing long waits for other patients in need, a lack of translation staff or materials for international patients, and personal reasons for not providing treatment. Additionally, asylum seekers may also need to cover the price of prescriptions or non-insurance covered treatment out of pocket, which is rarely possible with their lack of personal funds. In cases where providers are willing to see patients, it can also be the case where they are not approved by the government to provide care under that asylum seeker's health policy. Facing problems like these, for sick asylum seekers, the lack of access to medical care has led to many negative consequences. Now looking at the situation for asylum seekers living in France, they face many of the same problems as those living in England do. In France, views towards asylum seekers in the country have been increasingly negative as there have been multiple deadly terrorist attacks in recent years. The country has also experienced serious economic problems, including the loss of many jobs in different sectors and protests about wages. With an already struggling state of affairs for the country, French citizens have felt it is not in their best interest to take in many asylum seekers. Even though France's citizens are not overly supportive of asylum seekers in their country, over the past 10 years up until 2019, the number of applications for refugees seeking asylum status in the country has increased dramatically. These numbers alone have led to slow processing of applications, lack of available aid, and overall increased negativity, ultimately resulting in similar consequences seen in England. Like England, France also has a universal healthcare system known as PUMA, or PUMA. This system is also funded through taxes obtained by the government from its citizens. As an asylum seeker who does not pay taxes, in France, policy states that a 3-month residency is required to be able to use the healthcare services. This immediately creates problems for asylum seekers who are in need of immediate health services, but are forced to wait to see an approved provider unless it is an extreme circumstance. Other problems with the policy include the need to travel for long distances in order to reach a provider who could do treatment under the PUMA system. Furthermore, asylum seekers, much like in England, struggle to pay for prescriptions that are not covered, lack of translation materials and staff, and again, personal refusal from medical staff, although there has been more enforcement on this issue. Unlike England, however, France does have a unique policy that extends its healthcare services to asylum seekers in a different way. This policy allows asylum seekers to use the PUMA medical services up to a year even after their application for asylum status is denied. Though this sounds optimistic, the same problems as stated earlier still apply, and with fear of forced removal from the country due to their overstay of their application process, it is rarely used by asylum seekers. In both countries, a continued lack of access to medical care has been detrimental to the health of asylum seekers. Some of these people with severe conditions such as HIV and other diseases will continue to die without medical intervention. Pregnant mothers and ill children often also face struggles obtaining proper care while awaiting a decision to be made by the courts. While physical health problems are of immediate concern and should not be downplayed, there's also a lack in access to mental health services as well. Many asylum seekers who have migrated far from their home countries have had to endure exceedingly difficult situations during their journey. Research from the Mental Health Organization in England found that asylum seekers living in the country are 5 times more likely to have mental health needs than the general population. In addition, more than 61% will experience serious mental distress. The statistics from France show similar rates of mental health problems as well. Furthermore, the lack of open healthcare coverage has also led asylum seekers to hide their conditions as they believe it could be taken into consideration as part of their application process. Although the government in both countries have said that they cannot discriminate on that basis, it has led to further distrust of the medical system from asylum seekers. Altogether, the institutional and policy failure on the part of the National Health Services has further increased health problems and simultaneously decreased the quality of life for asylum seekers living in both England and in France. Now that I have discussed the many negative consequences that asylum seekers face due to the flaws in the medical systems in England and in France, I will explain what is being done to fix these problems. As stated earlier, the topic of refugees and asylum seekers is very tense in both nations. While some people openly protest and argue against their country's acceptance of the asylum seekers, which I witnessed firsthand during some of my interviews, others are advocating for the other side. Across England and France, there have been multiple rallies and protests against the government's treatment of asylum seekers in hope to change the policies for the better. These efforts and demonstrations have had direct impacts on the healthcare policy as changes have been made to try to alleviate some of the red tape around preventing access to some medical care facilities for asylum seekers. From a direct aid standpoint, there are also a number of charity and NGOs that are working out of both offices and remotely to provide access to healthcare services to asylum seekers who otherwise might not have been able to obtain treatment. From the photos on the right, I witnessed several mobile primary care, dental, eye care facilities, along with long lines of asylum seekers during my research in France. As privately funded organizations, the aid provided is paid for completely by donations without government resources. During my interviews with some of the employees and volunteers at these mobile units and permanent facilities, I learned that the workers are all very passionate about helping asylum seekers who are facing difficult situations and have commemorated each other for working to make a difference in the asylum-seeking community. However, they fear that without more public support and government funding, their aid will not be able to keep up with their healthcare relief. Although England and France both have a lot of problems to fix with their healthcare system, the work of advocates and aid providers are working to help alleviate the struggle and improve the quality of life of the thousands of asylum seekers of all ages in these countries. As I conclude my presentation, it is important to reiterate that the refugee crisis is extremely difficult, not just on asylum seekers themselves, but on the nations having to take them in as well. My goal of this project was to investigate the challenging lives of asylum seekers and explore what elements were causing the most harm during their efforts for a better life elsewhere. That being said, by pointing out the extreme lack of healthcare services in England and France in particular, asylum seekers of all ages are struggling to survive with any quality of life. I hope that this presentation provided a clearer picture of the healthcare battles asylum seekers face in France and England, on top of the already difficult circumstances, and leaves each of you thinking of what it would be like to be in their situation. Thank you. I would like to acknowledge a few people who have helped me make this project possible. First is Dr. Ishibashi, who has been my advisor throughout this process. Her guidance has continued to keep me focused on a path for success, not just the past few months, but throughout my entire 4 years. Next is the Center for Student Research and Luisa Carrera. She has been an amazing help with the RISE grant process and with my research itself. Lastly, I would like to thank Randolph College for providing me with the opportunity to obtain research overseas with the RISE grant, which has made funding this presentation possible, and for giving me the chance to share what I have learned with the college community. Thank you.